Lifestyle diseases such as cervical cancer are robbing families, mostly of their mothers, wives, sisters and aunties. According to the Ministry of Public Health, Kenya loses 18,000 people to cancer every year. The World Health Organization estimates that every year in Kenya, more than 60% of women diagnosed with cervical cancer in the country die.
The human papilloma virus is mainly transmitted by sexual relationship. So if we target these girls, we are doing a good justice in terms of prevention of cervical cancer in women and girls in Kenya.
However, through primary prevention, screening and early detection, cervical cancer can be prevented and cured in its early stages. In the last 6 years, scientists have managed to develop a vaccine that could protect against the human papilloma virus, which causes cervical cancer. The introduction of the vaccine in Kenya 2 years ago has, however, been non-receptive, given the fact that it is mainly administered in private hospitals in 3 doses at a cost of not less than 20,000 shillings per dose. Kenya now tops the leaderboard and is the first of 7 sub-Saharan countries to get support from the Global Alliance for Vaccine and Immunization to immunize against HPV at a subsidized rate that could see thousands of women protect their womanhood in 3 doses.
So in America, you would pay over $100 for each dose of the vaccine. And Gavi has worked closely with manufacturers to secure a price of $4.50 for each dose of the vaccine. So it's 20 times cheaper. It's something that then becomes affordable for the countries with Gavi.
In a pilot project set to be unveiled countrywide in the next 2 years, the Ministry of Public Health launched a HPV vaccination program in Kitui County to administer the vaccine to school-going girls aged between 9 and 13 years.
Okay. Standard 4 children, that age was decided because when you're looking at a vaccine, you're also looking at dropout rate, right? Now, the highest enrollment of this girls is in standard 4. So we thought choosing standard 4 would be the ideal age. So that after standard 4, they start dropping out. Standard 4 is when the highest enrollment of girls is. So that's why standard 4 was chosen as a cutoff age.
Shanaz says the vaccine that the over 20,000 young girls targeted in the program will receive will be protected against the virus long before they engage in sexual activities. For now, though, the experience of receiving a needle through their arms is hostile, but the Class 4 girls at Kitui Central Primary School vividly understand that prevention is better than cure.
So that I can't get cervical cancer. When I grow up, don't get cervical cancer. Cervical cancer is the disease that infects people infects women and girls. Cervical cancer is a killer disease.
Prior to the immunizations, both girls and boys will be provided with health education on HPV and cervical cancer, as well as hygiene and hand washing. The project will also deliver HPV vaccine with the support of community health workers to out-of-school girls who may be at a higher risk through local clinics and outreach programs. The Global Alliance on Vaccines and Immunization expects that by the year 2020, more than 30 million girls in over 40 of the world's poorest countries will have received the HPV vaccine.
So even as the girls continue with their joyful cheers, oblivious of the nature of cervical cancer, they know that they have just protected their future by getting the HPV vaccine. Reporting from Kitui County, I'm Wathithi Kanai.